When looking at the extraoral soft tissues, we look firstly at the face as a whole, the facial symmetry, the cheeks, the nose, philtrum and nasolabial groove. We look at the lips, the vermilion border, commissures and oral fissure, and lymph nodes, submental, submandibular and occipital. When examining the TMJ, we first do it closed, then we get the patient to open and close 1 or 2 times so we can feel for any clicking of the TMJ. We then get the patient to move to the left and to a right excursion so we can feel for any clicking and movement of the condyle.
We commence the intraoral examination by looking at the floor of the mouth, examining the soft tissues, retracting the lips, feeling bilaterally for any changes, abnormalities, lumps, variations. We then invert the lips and using the thumb and the forefinger, palpate those areas. Using our index finger, if we're right-handed, on our right hand, and placing the left hand under the mandible, we apply pressure to feel in both directions if there is any swellings, tenderness or abnormalities in the floor of the mouth, the submental and the submandibular areas.
Using a mouth mirror, we then look at the palate, where we are looking for the incisive papillae, palatal rugae, median palatine raphe, and the junction between the hard and soft palate. To look at the structures in the fauces area, we use a mirror to depress the tongue, get the patient to open very wide and say ah. We are looking for the uvula, tonsils, tonsillar fossa, palatoglossal folds and palatopharyngeal folds.
Ask the patient to put their tongue out over their lower lip. Use a piece of gauze and pull the tongue out firmly. Examine the dorsal surface of the tongue. Look at the papilla, look at the fungiform, the filiform and the circumvallate. Move the tongue to the side, examine the lateral borders, look for the foliate papilla. Lifting the tongue up to the roof of the mouth, examine the ventral surface. Look at the fimbriated folds, the lingual frenum and the deep lingual veins.